Welcome to this campus tour of Johns Hopkins Bayview, an academic medical center in East Baltimore. With 1,100 nurses in a wide variety of roles, we welcome experienced nurses and recent graduates alike to our team. We're thrilled to offer the prestige of a world-renowned institution with the personal engagement of a community hospital. Our staff grows in place as we fund advanced education, professional growth on our clinical ladder, and leadership opportunities like task forces and research projects. We know you will enjoy this brief glimpse into the work of our exceptional staff and hope to greet you in person on our campus very soon.
Hello and welcome to the tour of the Department of Medicine here at Johns Hopkins Bayview. I'm Michelle D'Alessandro and I'm the Director of Nursing for the Department of Medicine. The Department of Medicine is inclusive of three distinct areas, those that we built to respond to COVID, NP3, NP4, and WENS. The medical units of Med A, Med B, Carol Ball, the ICU units of the MICU still responding to COVID, the CICU, and then the step-down area of the PCU. Let me tell you a little bit about NP3 and NP4. We set both these units up almost instantaneously to respond to the needs of our patient population here within the community. Within the floors here, we have a lot of seasoned staff that volunteer to take care of this patient population, along with a lot of new staff who also stepped up. I think what's great about here is there's usually one provider that it works alongside the same nursing staff, so we've built a lot of teamwork in a short, finite amount of time. We have a medical intensive care unit that is 12 beds, and it's almost always full with patients that need a lot of assistance from the multidisciplinary team that takes care of them there. This unit has been in bio mode almost since the pandemic began, and they have done a great job at keeping up to delivering this model of care. Their neighbor next door is the cardiac intensive care unit. They're also a 12-bed unit who primarily deals with the cardiac population. What they do really well in both the CICU and MICU is really bring on new graduates in a great environment. Their orientation can take anywhere from 4 to 6 months to really make sure that you feel safe and adequate in delivering patient care when your orientation is complete. Once patients are feeling a little bit better, they're able to step down into the progressive care unit, also known as the PCU. They have done a really great job in responding to the pandemic. They also continue to have 3 IMC beds there and continue to take care of the cardiac population in the rest of those beds. Here at Johns Hopkins Bayview, we also have 3 general medicine floors. These 3 areas do a great job with onboarding new nurses and then also allowing them to progress in their career. So it is a really good place to not only stay for a long time, but also start your career and see what path you might want to take for nursing. Carol Ball, located in the Burton Pavilion, receives their care from a provider group known as SIMS. So very similar to a hospitalist, it has the same nursing staff and the same providers day in and day out. So the continuity of care is great there. They have a multidisciplinary team to get the best care for their patients. If I was a new nurse, I think I'd come here because you're going to build a strong foundation to where you can take your nursing career. We are like a family here. All the disciplines come together to build a community where we're going to take good care of our patients and we're going to take good care of each other.